Hello, everyone. My name is Bruce Douglas. I am a program director for the Healthcare Data and Analytics Association. Welcome to HDAA Insights, a conversation about careers in healthcare analytics. In this series, you'll hear from the people who actually perform and manage the work. Our panelists represent a cross-section of organizations from around the country: academic medical centers, integrated health systems, physician practices, and community health groups. They represent a variety of roles, from engineers, analysts, and data scientists to managers and chief data officers. Today in this series, we're going to focus on a day in the life of healthcare analysts. I got a question from the group, and a compliment, by the way. As a new learner to the world of data and analytics, I would love to hear how some of these amazing folks got to where they are. Did they go to school? Did they just, study healthcare analytics at school? Did you know that you were a kid, that you loved data? For me, that was yes. I got into baseball statistics. That was next thing I knew. I was in healthcare. So, anybody want to talk about their backgrounds a little bit? Mm-hmm. Yeah, Janae, I think you're probably the most recent entrant into the professional world here.
Background so diverse, so I'm going to give you a condensed version of it. I wanted to be an OBGYN from high school. I love seeing babies in utero, and I love to see them grow in utero. So I wanted to be OBGYN so bad, but chemistry was not for me. So I was like, okay, let me just pivot and go to nursing school. Did nursing, I did the prereqs for nursing, and discovered that nursing was not for me. I did CNA at Emory Midtown, actually, for a couple of years, and bedside care was not for me. So I was like, okay, something has to be for me in healthcare. That's where I want to be. We had a program called Health Informatics at Georgia State University that I looked into, and I took the first semester, and I was like, oh, this is it for me. I think I took information systems, like a computer information systems course, and I knew right away that the program was for me. And I got into data analytics when I found out that you can really tell a story with data. You can tell any story with data. You just have to clean it up and shape it and make it nice and pretty for other people to understand what is actually in the data and how it's going to help improve patients' lives. So that's what drew me to data analytics, and I pursued my master's in healthcare management and informatics as well. I did work in construction as a data analyst, very different from healthcare. It's not as complex as healthcare, but it's complex in its own way. But healthcare is where I've always wanted to be, and Emory is where I wanted to be since high school as well. So that's my condensed background.
So for me, I definitely had I don't know what I want to be when I grow up kind of experience in college. I ended up as a psychology major just because the classes were interesting, but not because I had some particular career aspirations. But somehow found my way into training to be a licensed nursing assistant. And I did that for a year, and like Janae, realized bedside nursing, not for me. But I was really intrigued by healthcare. And so at Dartmouth, there is a program that is sort of part of the medical school that's a master's in, well, it's changed sort of, but at the time you could do a master's in science in healthcare improvement. And that really spoke to me. And in particular, when I started to focus in on statistical process control charts, so being able to take a process and measure it, it really sort of started to take all of the change management and other sort of the psychology pieces that I had learned as an undergraduate, and human behavior, and actually start to look at it using math in a way that was really interesting to me. And so that was where I started, and I was an analyst for about 10 years before moving into the management role. So yeah, not a technical person. Didn't at the time didn't need those skills, and it's amazing to me sort of now the people who work for me, the level of capability and skill that they have is definitely not something that I think I would be able to do. So I'm really glad I got in when I got in, so that I get to still do this work and the analysis part without needing to have the technical background.
So I might have done a slightly similar master's program that's also no longer available, but at Washington University in St. Louis, I did a dual master's in health administration and information management, which I've described to folks as basically you learn about healthcare and databases for a couple of years. And so getting out of that program, I actually did an administrative fellowship, and that might be a path that some folks, if you're really interested in healthcare and learning the industry, kind of from the top down, could be an interesting opportunity for folks on the line to pursue. It's a 1 to 2 year formal, they call it a fellowship or residency that you apply for. This is 12 years or 15 years ago that I did this, and large and small systems around the country offered these programs, and you'd basically be embedded with the executive team, learn about the operations of the hospital, do a lot of data driven projects. And from there, I found myself in kind of progressively more technical roles. And when I got to Riverside, I was originally in a strategic planning role, but realized quickly that there was a need for an analytics department. So I proposed this back in 2011 to the leadership, and built the program from the ground up, and have grown it over time, gone through an epic go live over that time to get where I am today.
So I might be the only one who doesn't have any official healthcare background. So my degree is in mathematics. I got a master's degree in applied math. And then I wanted to do lots of different kinds of math. So I freelanced for a few years. I was an independent freelancer taking on random statistics projects, anything I could find. And that was good. What got me to shift into full-time healthcare is I was looking for something more mission-driven, really. Organizations doing really important work that matters a lot for society. They don't go on the internet and post on Craigslist that they're looking for a statistician. And that's where I was getting my freelance work, kind of. So it's been a good move for me. But yeah, that's my background, math.
Yep. You're not alone. I'll throw my 2 cents in. So what I've observed over the years is that there are a couple of paths that end up intersecting at healthcare analytics. One is, you start the healthcare route and you get interested in data and trying to understand the data and know why the data is important. And then there are people like Amy and me who start on the technology side or the math side, the statistics side, and want to do something that feels slightly more important than what I did at the phone company, which was run reports on how many blue phones we sold each month, And my background goes all the way, but my first coding job involved punch cards. So that will tell you how old I am at the phone company. But it was really sort of searching for a purpose, a higher purpose. I mean, that sounds corny, but really a higher purpose to the skills that I had that was attracted me to Emory. I felt like I took a step back in technology when I made the move, but never regretted it, because it's like I said, you work with smart people, you work on important questions, you help people's lives. That's a real thing, and that is a real benefit that I get, that I feel and felt from working at Emory.